could camp out on this slide for hours on end, but what we're trying to do is to compare and contrast Medicare versus Medi-Cal versus VA aid and attendance. In respect to VA, there are 9 different pension disability programs. We're just going to focus on aid and attendance today. On the Medicare side, what I'm trying to illustrate here are good and bad. Green is good. There's no income test, no asset test. We talked about admitted versus observed. We talked about the rehab process, the 3 midnights, the 100% for the first 14 to 21 days and 80% after that. Helen talked about the word plateau, but notice at the bottom, the word green and no recovery. Basically, Medicare is a great program. There's no asset income test or recovery test if you use that program. In contrast to Medi-Cal and VA, Medi-Cal has a lot of rules about income and assets and medical versus mental. You know, Helen mentioned dementia, Alzheimer's being a primary diagnosis, being a problem for skilled nursing. You'll hear people talk about spin down and look back rules and the married rates and IRAs, but notice at the bottom in red is the word recovery. And then notice over on VA, 65, active duty 90 days, 1 day during a period of war. And Helen, what are 2 activities of daily living? Walk us through those ADLs.
So in order to apply for the veterans benefit, we need a third party, someone that's taking care of you for bathing, dressing, hygiene, transferring from a bed to a chair of that sort, and ambulation, somebody with walkers, canes, wheelchair. So I need at least 2 of those activities of daily living that you're paying for services. And that's, then you're qualified for that area.
It was bathing, dressing, feeding, motion, ambulatory. Was it?
Hygiene.
Oh, I thought that was bathing.
Nope. So incontinent, you know, the bathroom.
Oh, okay.
Shaving. Some of them can't shave or brush their teeth. So that's the hygiene.
Or clip their nails.
Yeah.
So 2 activities of daily living. So for the veteran who served during a period of war for at least 1 day on planet Earth, because a lot of people go, well, my dad did not serve in the war. He was here in California at McClellan Air Force Base. No, he was active duty during a period of war for at least 1 day. And he has this opportunity to potentially get the aid and attendance program. Now, this program is income tested. It is asset tested. There are spin down rules and restrictions. There are look back rules. Some hours are okay, some are not. And then there's different marital rates. Like I said, I could talk for hours on this slide here, but it's easier to show you some cases of families where we apply these technical data points so you can go, okay, here's how this works for my family.
So this is Mr. Brown, and we changed his name, but this is actually a Medi-Cal case that we worked on. Mr. Brown, 82-year-old widower, he attended a live family training and set up an appointment to come in for a consultation. However, he canceled it. He figured he had his legal and assets all taken care of. However, Mr. Brown had hearing, he was a fall risk, cancer, heart issues, leg, and then 5 months after him canceling that appointment, he had 3 strokes in 1 day. One of them was even on the operating table. So they got him to admitted to the hospital. He had the surgery. Then he was sent over to rehab. However, he plateaued. And so those are the words that we've already went over. So the skilled nursing in this area is about $10,000 a month. Most people can't afford that.